Hi, Shay. I just wanted to come on here and say that you did an absolute phenomenal job on your discussion video. And I'm very excited to be replying to your discussion post. And I'm very excited just to be able to reply to yours, especially in the fact that you live in South Carolina and I live in Virginia. And it was also really cool to see the similarities and the differences um, that came with the agency that you chose and the agency that I chose in regards to what their informed consent entailed, such as similarities would be examples of when confidentiality would be breached, right? Child abuse, neglect. If they're going to hurt themselves or hurt someone else, that's when that confidentiality is breached. And also, both of our agencies discussed the significance and the importance of the client having the right to end services or to refuse services. And differences would be the main one, which you talked about, was actually, how the agency that you chose talked about videotaping. Mine did not talk about that. They didn't mention anything about audio recording, videotaping. And so I decided to do a little bit of digging on what the Virginia Board of Counseling said was okay to do in regards to videotaping and audio recording. And the Virginia Board of Counseling, said that videotaping and audio recording can be done. However, it must be used and the client's confidentiality must be ensured, and that they have to agree to whether or not they want to be recorded. And they have to have that consent first. If they want to video. So that was really interesting. That was something that I didn't know about Virginia. I was unsure of whether that was something that we were allowed to do. But we just have to, of course, have consent and keep that confidentiality and to make sure that their confidentiality is ensured. And so with that being said, to end all this, I think it's really important to note that just as Remley and Hurley 2014 stated, it can be difficult to achieve a balance between, providing perspective for the clients or giving, too little information or too much information. And it can be very overwhelming for the client. But with that being said, it's very important to make sure that, that they feel comfortable to ask questions and things like that in regards to the informed consent. But yeah, thank you so much for your discussion post, and I really enjoyed replying and watching it. Bye.